happy. Like, I'm not really good at telling my emotions, but I want to thank you from my whole heart that you've done so much for me. And I want to thank Dr. Sam and everyone from your team for being so supportive and caring. And she was literally holding my hand while I was having my toughest moments. So I will never forget. Sweet. I will always keep you in my heart, and I want to come back and see everyone again. And you've literally gifted me back my life and the chance to be with my family and live my life to the fullest. So thank you very much.
Very happy guys.
I know I've been a tough patient because I came here with zero trust in the whole medical system and everyone because of my previous experience. And what I can say is that now I have two people who I fully trust, because you did everything possible to make me believe again that there are caring and kind professionals who are not just professionals but also great humans. So thank you.
Thank you so much. So creative.
This is your star because you are shining over your face. So beautiful.
That's really nice.
Lovely.
It's named after you.
Today's day is something which I was eagerly awaiting for, because we've been going through a batch of highly complicated fistula cases. You know, sometimes it happens that you have all cases which are super complicated. You know, there's no mention in the literature. Every case is unique, and then you have to deal with it.
Yes.
So I'm happy that both of you are cured, and this is actually what we have envisioned long back. You know, when we see the case, we believe that the patient will be cured. The journey is definitely tough, and since every case is different, every body behaves in a different way, the healing time also differs from person to person. And that's the trick in treating fistula actually, you know, that as a surgeon we have to understand how is the body's response to the disease versus approaching the disease with one mindset and doing what we do for everyone. That doesn't work. So, you know, in almost every case, if you talk to our patients, you'll understand that every case is different. We have to do a lot of remodeling. The ends are usually, you know, lengthy ones, you know, because we want the patients to be 100% cured. We don't want it to come back again. So we are very careful, and that's how it is.
Yeah.
Very rarely we get lucky, wherein a patient heals in 8 weeks and 10 weeks, and that's the happiest moment.
And most important.